Hi, my name is Jackie Abeda, and I'm with Grand Valley State University here in Traverse City at the University Center. We wanted to take this time to share some information with you about some local opportunities that we have, and I have some contact information on my slide here. You can schedule an appointment with me if you're interested in Grand Valley, whether you're thinking of staying in Traverse City or going down to Grand Rapids, where our main campus is located. I'm happy to help you create a transfer plan. I've included our email address, our phone number. Please feel free to reach out. But I brought some amazing colleagues with me today to share more about what opportunities are here in Traverse City for you related to the health fields.
All right, my name is Kelly Aubrey, and I am an instructor in the Allied Health Sciences program here in Traverse City. So this is a bachelor's degree program, and you can actually complete this degree as a dual enrollment with NMC. So we have our students take their core science classes at NMC, and then you take your allied health science classes in Traverse City at Grand Valley. So we use a hybrid class model. So our classes are all in the evenings, and we meet between 3 to 5 times per semester, depending on the class. So what's really great is a lot of my students have families or full-time jobs. It's very flexible and accommodating to a busy schedule. We also offer a health professional degree completion. So if you already hold or will hold an associate's degree or a certificate of some kind, you have experience as a healthcare professional already, we can count that towards some of your credit requirements here for your bachelor's degree, which is wonderful. We also help with job shadowing or internship opportunities if you're looking for some more experience in the healthcare world. And what's great is that there are clinical and non-clinical tracks that you could take this degree. So it's a great program if you know you're interested in healthcare and you want to keep your options open. It's a really great degree if you're looking into a graduate program such as physician assistant, physical therapy, occupational therapy, dietetics and nutrition, pharmacy, dental, orthotist and prosthetist, or even medical school. Lots of options there. There are also non-clinical opportunities, things like public health, epidemiology, research. You could go into health education or healthcare administration, quality improvement, healthcare compliance. The options are really endless. So a lot of these are conducive to going on to a graduate degree, but there's also some of these non-clinical opportunities that are attainable just with this bachelor's degree. So this is just a great program we're here to help you discover your dream healthcare career. We will have an event coming up that we want to make you aware of. It's this Wednesday, February 21st from 11 a.m. to 1 p.m. Jackie and I will be in the health science building to talk to you guys about navigating healthcare careers. So we'll just be there to have a conversation with you, have some hot cocoa, and you can pop in anytime between 11 and 1, and we're happy to chat with you some more. And with that, I want to hand it over to Pat, who is part of the physician assistant program here in Traverse City.
Thank you. So my name's Pat Smith. I'm a physician assistant, and I'm a professor here in Traverse City for the physician assistant program. Thanks, Jackie. So we currently have 12 students here in Traverse City. You can do all of your training, and this is one of the options you can do with your allied health degree, is that you can turn around, go back to school, and go for your master's. And you can do that all here locally in Traverse. That's why I really want you guys to know, is that we can do all the training here. So you end up with a master's in physician assistant studies. That's what MPAS stands for. The focus here and the reason that we're here is we found that we want to improve rural healthcare in all of northern Michigan. When I say all of northern Michigan, I'm really talking north of US 10. That includes everything in the northern lower peninsula and vast majority of the upper peninsula, obviously. So we have students that are currently in these areas. We have graduates that are in these areas that have graduated, started practicing, and they're out, they're working. We also participate in a hybrid lecture model. So we have 12 students here, and we also have 36 down in Grand Rapids. And so we lecture from not only from Grand Rapids up, but we also lecture from Traverse City down. Currently, my other professor, Dr. Kopacki, is currently lecturing actually right now from Traverse City, going down to Grand Rapids. Some of the things that we do here, so your first semester would be anatomy. So how do we do that here? We have a plastin anatomy lab. So these are actually real cadavers that have been dissected by anatomists, and they're perfectly formed what positions we need them to be in, so you can study off of them, but they're all plastinated. So it's a really different kind of exciting thing, which brings me to my next point. If you want to see some of the things that are here, Friday, March 22nd, 11 a.m. to 1 p.m. We have a introductory kind of meet and greet. Highly advise you to hit up the link on the screen right now. Get some more information about it. Come visit us, see what it's like here, see what we have to offer here, and just come kind of hang out for a little bit and see what we have to offer. Getting back into the mix of it, if you want to know a little bit more about what to expect, it's 4 semesters in the classroom, 3 semesters in the clinics. And that's what I said, our students, they're out all of Northern Michigan. Last week I was up in Escanaba, visiting some students there. I was over in Gaylord. Today I'm going down to Kingsley. Tomorrow I'll be in Manistee. And that kind of gives you a perspective of how far our students are reaching right now. And these students, once they go in the clinical placement, what we found through research is that that's most likely where you're going to stay. That's where you're going to get your jobs. And that's what most of our graduates have done. We've been showing roughly around 75% of our graduates are staying in Northern Michigan. So it is working. We are primary care focused, and I do the ... because we also have many people that have gone into specialty care. I still practice in emergency medicine. I'm not considered a primary care specialist, but most of our students do graduate and they go on to primary care. That's still the vast majority of our students. We have that focus, we have that drive for that. But we still have students that do emergency medicine. We have students that have gone to cardiothoracic surgery. We have students that are actively working in the trauma acute care surgical service right now, graduates, I should say. We have students that have gone into neurology. You can think of most of the specialties. We probably have a student, if not from Traverse City, from downstate. So if you have more questions, please, by all means, come join us Friday, March 22nd, 11 a.m. to 1 p.m. Hit the link, get some more information on it. If you guys have any questions for me, please reach out to your teacher. They'll get you the contact information. You can go from there. All right, appreciate it. Thank you.
Great. Thank you. And this is just a small snippet of the health opportunities here in Traverse City. We have a variety of programs. So I encourage you to take a look at our website, gbsu.edu/Travers, and look at all of the opportunities that are available so that you could find a program that fits your needs. Thanks so much. Bye, everyone.
Bye.